Hi, and welcome back to my channel, Simplified Psychopathology. This is Ritvik Sharma, your host. So we were doing introduction on CBT, or the cognitive behavioral therapy, introduced by Aaron Beck. So in this video, I will talk about the therapy techniques, how we work upon the patients or the clients using cognitive behavioral therapy. So in cognitive behavioral therapy, we works on identifying the patterns of thoughts which are coming on a patient. If a patient is going through anxiety or depression, there are some kind of pattern of negative automatic thoughts which are coming into the patient's mind or the client's mind, and that pattern is going on and on, again and again. And that is also affecting his or her mood, and also affecting his overall behavior, and also affecting if some kind of situation is happening. It can be a small situation or a bigger situation, and that situation can trigger that problem more and more because of that pattern which is going on. So with cognitive behavioral therapy, we can work upon identifying those thought patterns. And after identifying those thought patterns, if I take a person as Harry, and Harry is going through a depression because of some kind of breakup which he recently had, and also because of that he is having negative automatic thoughts of like he will not be able to find love again, or he will not be able to find a partner again. He will not be able to find a good person again. So that these are the negative thoughts or the thought patterns which we would be facing again and again, and if because of those thought patterns he will not be able to meet new person or meet new partners, or what you can say, make new friends as well. So we have to understand what kind of thought patterns your clients is bringing, and then we have to work upon those thought patterns, and then we have to break that cycle of the thought patterns. And after breaking that cycle of that thought patterns, we have to work upon those negative automatic thoughts which the patient is having or the client is having again and again if some kind of situation is coming, or if the situation is not even coming, then why this anxiety is building up. We have to understand that, and then according to that we have to work upon that automatic negative thoughts, and we have to change those automatic negative thoughts to less negative automatic thoughts, and then we can work. So how we will identify the negative automatic thoughts? Through introspection. We can work upon it, or the psychologist can ask some of the secretive questions like how are you, or your what kind of mood you're facing. Okay, like we can ask what kind of negative automatic thoughts are coming in your mind, or what kind of thoughts. We will not talk about negative. I'm sorry. We can simply say what kind of thoughts are coming in your mind, and how are the things going on in your life. Are you able to make friends, or are you able to talk to people, and what kind of feelings are coming, what kind of, and when was the last time you faced that anxiety issues or the depression issues. These kinds of questions can be asked so that we can understand the thought patterns of that patient or the client, and what kind of thoughts are having in the patient's mind. And the patient or the client can do introspection, and by taking the time to identify these thoughts can also lead to self-discovery and provide insight that are essential to treatment process. So because of these questions or the introspections of which the client or the patient is having, we can understand what kind of thoughts which we are having, and we can do a self-discovery as well. We can also use practicing new skills in this. Like if a person is having substance use disorder, we can might practice new coping mechanisms, rehearse ways to avoid or deal with social situation that could potentially trigger a relapse. Like if a person is doing smoking because of some kind of anxiety, or because of some kind of depression or something, we can talk about that. We can talk about it to the patient, and we can understand why is he taking that cigarette, or why is he boozing, or why is he having alcohol, and then we can work upon that negative automatic thoughts, and then we can lead to the change that negative automatic thoughts to less negative automatic thought. So and another time, if any kind of situation will occur, the patient will not go into that anxiety level or trigger that thing so that he will go into the substance use again. Okay, so like if the patient is having some kind of depression or anxiety because something happened to in his or her family, and somebody scolded us and he went to have some kind of cigarette because he was not able to understand what happened in the family or not able to talk to the people. So we can simply talk to that patient or the client about it, give him an analogy that the cigarette will not help in this thing. And you can simply talk to that person in an easier way, in an easier form, where you can understand more about the situation, and that can be more solution focused. Here, the solution is not coming, and you're just going for the cigarette, and that is not helping you in any ways. So these kinds of analogy can be given to the patients or the clients, and then we can work upon the coping skills, and we can also give some kind of defense mechanism, and we can work upon the substance use disorders as well. Okay, this is how we do the cognitive behavioral therapy. And in cognitive behavioral therapy, we focus on the goal settings that we can recover on the mental illness. We can recover from the mental illness, which can also help you to make changes to improve your health and life. Okay, if we work upon a substance use disorder or an eating disorder, we can, or anxiety, we can actually work upon the overall health as well and the life which the person is having. Okay, this might involve teaching you to identify your goal or how to distinguish between short-term and long-term goals. It may also include helping you small goals, okay, and with a focus on process as much as the end outcome. It will also focus on the end and the outcome. And also because of the we are facing focusing on problem solving skills. So if the person is focused on the problem solving skills, he will not lead into anxiety or depression or any other thing. I can understand that if the person is facing major depressive disorder, he will not be able to work with these kinds of Socratic questions or these kinds of intriguing questions which the psychologist will ask. So in this, we can simply ask, work upon slowly and gradually. We can use CBT, or we can, if the patient is having some kind of major depressive disorder, we can work CBT with some kind of medicines as well, like lithium, or and also we can use medicines of mood disorders. Okay, and also we can work with expressive art therapy or any other therapy which we can use if the client is having major disorders. Or these goal settings can, or of the CBT can be used in relationship therapy, or or you can say family therapy can be used. If that is not a big disorder, we can simply use how to select a goal and how to break that thought pattern, and then we can work upon it using the cognitive behavioral therapy. We should be problem solving focused so that we can work upon that problem and break that pattern, and then after that we can work upon the mental disorders. Okay, so we can identify the problem, generate a list of potential solutions, evaluate the strength and weakness of each potential solution, and then implement the solution. The patient can also do a self-monitoring, or the therapist can ask the self-monitoring to be done if the client is having some kind of, what you can say, eating disorder, or what you can say, we talked about smoking or the substance use disorder. So these types of thought patterns can be changed. The negative automatic thoughts or the obsessive compulsive thoughts which are coming, it can be changed to a positive automatic thoughts or a less negative automatic thoughts using cognitive behavioral therapy. So this is all about cognitive behavioral therapy and introduction, how we how we talk about goals and how we work upon patients or the clients using cognitive behavioral therapy. In my next video, I will talk about cognitive distortions or the fallacy, or I will also talk about fallacies and how we can work upon those cognitive distortions. I will simply make you understand what are cognitive distortions and how we can work upon them. Thank you.